Hello everyone. Today I am presenting a meta-analysis on effect of virtual reality intervention on neural plasticity in stroke rehabilitation. As we know, stroke rehabilitation play a crucial role in helping patients regain functional independence, and neural plasticity is central in this recovery process. The increasing integration of technology in rehabilitation, especially virtual reality, offers a great promise for enhancing neuroplastic changes. However, clinical effectiveness of VR is promoting these changes remain under debate. This paper is significant because it provides a comprehensive evidence-based evaluation of VR's impact on neural plasticity, offering valuable insight for both researcher and clinicians. And my goal in this presentation is to share key findings from this systematic review and discuss its implication in our clinical practice, as it directly aligned with our ongoing effort to improve stroke rehabilitation outcome. So in background, stroke rehabilitation, as we all know, stroke remains one of the leading cause for a long-term disability worldwide, significantly impacting patients' ability to perform daily activities and affecting their overall quality of life. And post-stroke rehabilitation typically involves a interdisciplinary approach, combining therapies like physiotherapy, speech therapy, neuropsychology, and all, to help patient recover function and reintegrate into life. However, with advances in technology like virtual reality has emerged as a promising tool in neurorehabilitation, and VR allows for creation of immersive environment that support task specific training and provide real-time feedback, motivating patients to engage more effectively in their rehabilitation processes. And past studies have demonstrated that VR can enhance various aspects of recovery, such as upper extremity functions, gait, balance, and even cognitive ability. Furthermore, VR based systems are becoming more accessible, cost effective, portable, and making them suitable for home based rehabilitation post discharge as well. A key mechanism underlying recovery after stroke is neural plasticity, the brain's ability to recognize and form new connections. VR, by offering engaging, repetitive, and task specific exercises, facilitate neural plasticity, which is very essential for improving motor and cognitive functions. While current study show the positive outcome, the precise neural mechanism driving these effects are still unclear and not fully understood. And this is why this is important study, and this review seeks to explore the relationship between VR based rehabilitation and neural plasticity, aiming to provide insight into underlying mechanism and refine VR intervention for more effective rehabilitation strategies. So, moving to methodology, let's discuss detail what methodology the author have used. So, this review adheres to the PRISMA guidelines to ensure high quality and transparent reporting of the findings. And this is well established set of protocol that helps maintain consistency and rigor in systematic reviews. To enhance the transparency, they have also registered this review at Prospero registry. For your information, I have included the URL as displayed on your screen. You can go and learn detail about what the PRISMA guidelines are. PRISMA guidelines are, in short, are internationally recognized standards for ensuring the quality and transparency of systematic reviews and meta-analysis. And by adhering to these PRISMA guidelines, we can be able to maintain high quality reporting and ensure consistencies throughout the review processes. Moreover, This review was registered with Prospero, which is again a registry for systematic reviews in health and social care. So, moving to their review method literature, so how they have searched the literature. So, author has conducted a comprehensive literature search across 6 major databases, and these databases were selected due to their extensive coverage of clinical and neurological literatures, ensuring a wide scope of research on virtual reality and stroke rehabilitation. The search focused on studies published between 2000 to 2021, which is a good relevant time frame to capture recent advances in both VR technology and stroke rehabilitation. Additionally, all included study were required to be published in English to maintain the consistency and ensure the quality of included study. Right. So, to narrow down the search to relevant study, the authors used in a careful constructed set of search terms. These terms combined like virtual reality, stroke, neuroplasticity, and this combination ensured that the search was focused on research questions addressing that the intersection of VR intervention, their effects on stroke recovery, and their potential to influence neural plasticity. One of the key mechanism underlying is rehabilitation outcome. In eligibility criteria, moving to eligibility criteria, the author defined specific inclusion parameters to ensure relevance and quality of studies in their systematic review. Like in this study, they selected the participants for review, included a stroke patient aged 18 year or older, and this age range was chosen to focus on adult population typically involved in stroke rehabilitation, which includes both younger and older adults with varying stage of stroke recovery. The primary intervention investigated in this study was VR based rehabilitation, and this includes all form of virtual reality therapy designed to aid in recovery of stroke patient by engaging them in interactive immersive environment aimed at promoting motor recovery and cognitive function. The outcome was in this review was selected the outcome neural plasticity, which is measured through neuroimaging and electrophysiological techniques, and these methods helped to visualize and assess the changes in brain structure and function, critical marker of neural adaptation and recovery in stroke rehabilitation. The study type they included in review were primarily clinical trials, specifically randomized control trial RCTs and clinical control trial CCTs. And these trial design were selected for their ability to provide strong evidence regarding the efficacy of VR intervention by controlling and confounding variables and ensuring a rigorous comparison between experimental and control groups. The data extraction process in this review involved two independent reviewer who screening article to ensure unbiased selection, and the key data collected included participants characteristic like age, stroke severity, VR intervention types like immersive versus non-immersive VR, neural plasticity measure using functional MRI, EEG and EMG and TMS, and study outcome were used for functional recovery as well. The quality of randomized control trial were used quality for quality. They use the Pedro scale, which is while NIH quality assessment tool were used for the study designed to evaluate the biases. And I have included the URL here on your screen displayed, so you can go and read more about the Cochrane handbook to understand what the Cochrane risk of bias and NIH quality assessment tool, right? So after the data extraction, they move to data synthesis process, and the data synthesis used in a narrative approach focusing on study types, VR intervention, neural plasticity outcome, and functional recovery. The VR interventions were categorized based on system type and task, and the neuroplasticity measures assessed how VR affected brain changes. The synthesis was also explored how VR intervention influenced motor function and cognitive recovery in stroke survivors, helping identify trend and gap for future research, right? So to ensure rigorous data collection, two independent reviewers screened the study, as I explained earlier, with any disagreement between them that was settled by a third reviewer for quality author used physiotherapy evidence database scale for randomized control trial RCT and CCT, while addressing other study design using NIH tool and Cochrane risk of bias tool to evaluate quality of this, right? Then moving to result and outcomes. In this study, they identified the 232 record initially identified, and after screening those articles, the 142 articles were selected for further review. Out of those, 29 full text articles were assessed for eligibility, and 27 studies were ultimately included in systematic review. The included studies comprised various study designs, like 6 were randomized control trial, 2 were controlled clinical trial, 11 pre-post trials, and 7 case series articles were there included. And this diverse mix of study type provided a comprehensive overview of the effect of virtual reality on neural plasticity and stroke rehabilitation, right? So moving further, in result outcome section, the virtual reality system used for intervention in this reviews studies focused on sensory motor rehabilitation. A range of VR system were employed, and including population devices like Nintendo, Leap Motion, and Kinect, as well as more advanced systems like robotic VR and immersive VR technologies. These systems were applied for in a variety of rehabilitation processes, such as training for upper limb function, lower extremity functions, and improving balance and enhancing cognitive function. The wide variety of VR system allowed for tailored intervention, targeting a specific area of stroke recovery and neural plasticity enhancements. Moving further, for quality assessment, the studies included in review were evaluated based on their methodological factors, and among randomized control trial, the 6 studies were rated as a good quality with a Pedro score of greater than 6, indicating that a strong internal validity. The 2 control clinical trial were rated as a moderate quality, suggesting that a reasonable level of reliability, but also has some limitations. While the pre and post trial and case series, which were more observational in nature, were generally rated as in a fair quality, reflecting that the a lower level of methodological rigor, but still providing valuable insight into effect of VR rehabilitation process. Author found strong evidence of neural plasticity induced by VR intervention and shown by functional MRI, EEG, and TMS results. So, functional MRI revealed increased activation in ipsilateral sensory motor region as well as in bilateral motor cortex, indicating the brain's adaptive response to VR based rehabilitation. While EEG showed high cortical activation, particularly in frontoparietal region, which is associated with motor and cognitive function, again suggesting enhanced neural engagement during VR system. And the TMS demonstrated expanded cortical map and improved interhemispheric symmetry, again suggesting that the VR intervention may help to re-establish balance between brain's hemispheres and promote the recovery of motor control. Right? So, in addition to neuroplasticity, they also used functional outcome measures, and they were measured particularly focusing on body function and activity limitation according to ICF model. And here I have included the URL on the slide. You can go ahead and see that what actually ICF model is. And there was a clear correlation between improvement in neural plasticity and functional recovery. In short, ICF model is international classification for functioning, disability, and health, which is provided by WHO. It is a standardized framework to assess health and quality, health and disability holistically. It integrates physical, psychological, and social factor encompassing the body function, activity, participation, and contextual element like environment and personal. And it is widely used in rehabilitation policy making and research, and it promoting the holistic nature of care. Right. Moving to discussion section, in discussion section, the authors analyzed the findings from systemic review and provide insight into their broader implication for stroke rehabilitation and future research. And they interpreted that the evidence on effectiveness of virtual reality intervention and reflect on methodology and results of the study included in review. And it emphasizes that the benefits such as task-specific training, where VR system were designed to provide repetitive practice of a specific motor task, which is crucial for motor recovery post stroke. And this approach help patient to practice real world activity in controlled virtual environment, enabling them to work on motor function in a way that traditional therapy might not be able to provide. The second is gamification. And the gamification, game-like element in virtual reality interventions encourages engagement and motivation, making rehabilitation more enjoyable and encouraging consistent participation. And these features are especially important in stroke rehabilitation, where adherence to therapy can be a challenging factor. And the last, they mentioned that the adjustable difficulty level in VR systems. VR system offers an ability to modify the task difficulty to match the patient's progress, ensuring that the therapy is always challenging but not overwhelming. Right, so this personalized approach help patient continue to make improvement in their own pace. This review also concluded that the VR intervention hold a significant holds a significant improvement in personalized approach, significant potential in promoting neural plasticity and improving motor function in stroke patients. And by providing immersive, repetitive, and task-specific training, VR system helps to stimulate the brain and facilitate the process of neuroplasticity. And the repetitive nature of VR tasks can help reinforce motor learning, promoting challenge changes in brain that enhance recovery. And the ability of VR to stimulate complex interactive environment allow for intensive practice, which is very vital in stroke rehabilitation processes. So they also, in discussion session, they also have mentioned that what possible way this improvement have been taken place. So VR intervention holds significant potential in promoting neural plasticity and improving motor function in stroke patients by providing immersive environment and task specific training. VR support rehabilitation process that may be more effective than traditional methods alone. So like what they have mentioned, that the possible mechanism is immersive and task specific training. VR offers immersive and repetitive training that focus on a specific task, which is crucial for stimulating brain area involving in motor recovery. And this training helps patients engage in meaningful activity that mirror real world scenario, enhancing the functional recovery. And the second mechanism may be reinforcement of motor learning. The repetitive nature of VR task is fundamental in reinforcing motor learning by constantly repetition of motor task. VR can encourage the brain to reorganize and form new connections, facilitating the recovery through neuroplasticity. And finally, the mechanism may be involved is simulation of complex interactive environment. The VR can create an interactive and complex environment where a stroke patient can practice motor task intensively, and this system simulation of daily life task allow for more comprehensive practice and functional improvement, offering a rich rehabilitation experience compared to traditional therapies what we have practiced. So in short, VR intervention are powerful tool in stroke rehabilitation, offering numerous benefit for neural plasticity and motor functions improvement. And these interventions allow for repetitive, task specific, and immersive training, which are essential component for effective stroke rehabilitation. Through these mechanism, VR provides platform where patient can engage in intensive practice, significantly contributing to functional recovery and improved motor outcome. The authors have mentioned the key findings and in their conclusions, like virtual reality, the key brain area activated by VR and virtual reality intervention have shown to increase the activation in key brain area involved in motor control, including that the primary motor cortex and supplementary motor area. And this enhanced activation is crucial for motor recovery. Additionally, the VR promotes motor map expansion in affected limbs, signaling cortical reorganization, and this improved communication between the motor cortex, parietal cortex, and cerebellum support the overall recovery process by enhancing coordination and motor functions. The second key benefit what they have mentioned is restoring interhemispheric balance. After a stroke, you know that the affected hemisphere often compensate for unaffected hemisphere often compensate for affected hemisphere, and VR intervention can help shift brain activation from contralateral, that is unaffected hemisphere, to ipsilateral, that is affected hemisphere. And this restoration of interhemispheric balance is very, very crucial and vital for motor recovery, as it promotes better motor control and enhanced coordination between both hemisphere, which is very, very essential for effective functional recovery. The next one is the VR can enhance cortical connectivity. Another significant findings what they found was the VR has ability to enhance cortical connectivity within the brain, particularly between ipsilateral motor cortex and other important region involved in motor control, such as parietal cortex and cerebellum. And this enhanced connectivity support the brain's capacity for neural plasticity and reorganization, helping patients regain motor control and improve motor function after any stroke, right? So the next one is what they have mentioned is that there was a frontal lobe activation and cognitive recovery. So what they have mentioned is VR intervention also activate the frontal lobe, which is associated with important cognitive functions such as attention, motor planning, and executive functions, to execute functions. And the activation of this brain region not only add to motor recovery but also enhance the cognitive abilities, and which is necessary for executing motor tasks. And this combination of improving both the motor and cognitive functions leads to more effective rehabilitation process overall. And in TMS, what they find that the TMS motor mapping and motor map expansion. So through the techniques like transcranial magnetic stimulation, the study study included in this review have shown that VR intervention leads to motor map expansion, and this expansion indicate increased cortical excitability and the reorganization of brain area responsible for motor control. And the more importantly, this motor map expansion correlate with improved performance in motor task, further emphasizing the BR's role in promoting neuroplasticity and functional recovery. Then another findings what they have mentioned is mirror neuron system activation. Like VR also activate the mirror neuron system, which play a crucial role in motor learning. And by allowing patient to observe and imitate movement in a virtual environment, VR can help stimulate these neurons, adding the brain's ability to stimulate and refine motor skills. And this mirror neuron activation not only support motor skill acquisition but also significantly contribute to rehabilitation processes, helping patients regain movement more effectively, right? So this review of course has a promising promising insight about the VR intervention and VR induced neural plasticity. Of course, there are some limitations they have mentioned, and that is that the review has notable limitations. What they have mentioned is it included only 9 controlled trial and with a small sample size, and variability in VR system and neural plasticity measures, which reduce the reliability and generalizability of the findings, which many studies also overlook the clinical factor like lesion type, what type of a stroke and stroke severity, and that may be an potential biases. And the further study should be prioritized on basis of larger and high quality RCTs with active controls, standardization protocol, and long-term outcome assessment. While evidence is promising, more robust studies are needed to confirm VR's role in stroke rehabilitation and its effect on neural plasticity. So there are some as a presenter and reading this review, as we wrap up this presentation, the systemic review on effect of VR in stroke rehabilitation. Here, I would like to focus on both the strength and weaknesses of this literature reviewed in this review, as well as some debatable point we need to discuss. So a strong point of this literature was that it has a comprehensive literature search and inclusion criteria. Good. So author has conducted an exhaustive research across multiple major databases, ensuring a broad and inclusive review of article, and this robust search methods helps ensure relevant studies were found. The second was in a clear and detailed data extraction processes. The data extraction process was well defined, captured, and broad spectrum information from a study designed to outcome measure were included. So the next one is use of advanced neuroimaging. That's a very crucial in this review. I found that the inclusion of that utilize advanced neuroimaging like functional MRI, EEG, and TMS adds the significant value to the review, and these methods provide objective and quantifiable insight into the effect of VR on brain reorganization, which is a major strength in understanding underlying neural mechanism of the recovery, right? So another thing is evidence of neural plasticity changes. One of the key strength in this review was the evidence of neural plastic changes associated with VR intervention. Increased activation of F's lateral motor cortex, enhanced connectivity, and improvement in interhemispheric balance all point to the positive impact of VR on brain function, which is critical outcome of stroke rehabilitation. Another strong point was a strong potential for clinical application. The finding highlights the VR as promising intervention for stroke rehabilitation with the potentials to complement the traditional therapies. This valued contribution, right? So of course there are some weak point of found that there was a heterogeneity in VR system, and one of the major weakness I identified in this review, that heterogeneity of VR system used across the study. The variation in type of VR system, like whether it was semi immersive, non-immersive, or immersive, and the design of intervention makes it difficult to draw a definitive conclusion how about the VR features, what is the most effective, and this variability called for more standardized VR protocol to be assessed. And that there was a small sample size, of course, and many studies included in this review was having a small sample size, and there was a lack of long-term follow-up. The majority of the studies were not included long-term follow-up to assess sustainability of VR-induced functional recovery. There was a limited standardization of outcome measures. Like review also highlight that the use of various outcome like FMA, WFMA, Barthel, which can be complicate comparison between study. The lack of unified standardized measures may be more suitable. And there another weakness can be that there is a potential bias. Some of included study were pre-post design or case series, so which inherently lack control group and are more prone to have biases, right? So that we need to understand. There are some debatable point here like a role of immersive VR effectiveness, impact of cognitive function on motor recovery. That again we can have a big debate on that. Long-term effectiveness of VR has to be understood, and the cost effectiveness of VR in clinical setting like tool, another point is worth debating. While VR offers engaging and customization rehabilitation, its initial setup cost may be, and a particularly more immersive VR system could be a barrier for widespread implementation, right? So Those are the debatable point here. And finally, in conclusion, as a presenter for this review, systematic review, I would say that it provides a strong evidence supporting the use of VR intervention in stroke rehabilitation, particularly in promoting the neural plasticity and functional recovery. However, there are limitations highlighted in literature, such as variability of VR system, small size, sample size, and lack of long-term follow-up. Suggests that there is still much to be done before we conclude that the universally adopted clinical setting and the VR system. And the further research should be focused on a standardized protocol, larger and more diverse sample size, and long-term follow-up studies to better understand the lasting impact of VR on stroke recovery. The debate on immersive level, cognitive training, and cost effectiveness should be also guide for next generation of VR system based rehabilitation study. So this is all from in this presentation. Thank you so much for your attention, and I look forward for your question for further discussion on these points. So I have included the acknowledgement here. I would like to take the moment to acknowledge the outstanding contribution to of the authors of this paper, and their meticulous work has provided valuable insight into effect of virtual reality on neural plasticity in stroke rehabilitation. And also I extend my gratitude to institutions where they belongs to, and they are fostering the innovation in neurorehabilitation. And special thanks to those people and Neurophysiotherapy India Journal Club for this platform to share and discuss such transformative findings. And lastly, I dedicate this presentation to all the stroke survivors and their family, who remain a constant source of inspiration for us to advance, refine the rehabilitation practices to, and helping them to recover and get back to their life again. So thank you so much for now. And if any further questions, you can put on your questions in query, and I'll be happy to answer. Thank you so much.